We are here live today in beautiful Santa Fe, New Mexico for PHA's 2025 Leadership Summit. Today is the first full day of the summit, and we're very fortunate to be able to snag Dr. Bill Ritchie to speak with us for a couple of minutes. Dr. Ritchie is the former president of the New Mexico Medical Society and an orthopedic surgeon. Bill, thanks for being with us.
Thank you very much. Appreciate the invitation to be here. I'm an orthopedic surgeon in Albuquerque, New Mexico. Been here for over 30 years. Have seen the climate here for healthcare change greatly over this time period. And so I've been very active because of that for years now, both at our state capitol, which is right on the horizon for us, also up on behalf of the Orthopedic Academy in Washington, working with our senators and congressmen, as well as the rest of the Hill. And so what we are dealing with mostly here, besides being in a very rural state where we have a lot of difficulty recruiting physicians and all healthcare practitioners, is we have a terrible problem with medical liability and medical malpractice.
Bill, tell us more about this extreme malpractice environment and how this climate here in New Mexico really affects physicians and physician-led care.
It is just a culmination of many different factors here. These are found other places in the country for sure. We are rated right behind Pennsylvania as the worst state in the country as far as medical malpractice climate is. And a large part of that is because some of the stats, like we have twice as many cases as average across the states. And Pennsylvania is the only state that has more cases per capita. Our payouts are almost twice the average across the country. And yet our economic situation is at the bottom. So they affect our economy much more than they would in other states. And we have been to the Capitol multiple times, and it's multiple factors. We have venue shopping. We have all these things that we're trying to get corrected. And the legislature and the Trial Lawyers Association are very powerful here. And so medical malpractice is a state-by-state issue. You can't fix it federally. Everyone is pretty much agreed on that. But yet, I think states can learn from each other and try to build and try to get some reform. Our neighboring states have really good reform, Texas, Arizona. But we've got to keep it going because we are the only state in the country to have lost absolute number of physicians in the last 5 years. We have fewer physicians in the state than 5 years ago. That's the only state in the country that can say that.
That sounds like a crisis to me.
It is. And over half the state's population is currently in an underserved healthcare population area, acknowledged by the federal government. Over half our population, over 90% of the counties in this state are considered underserved.
So, Bill, lastly, tell us about your future plans on how you're going to tackle this and how physician-led healthcare, how physician-owned and led hospitals can be a solution around this extreme climate that we have here in New Mexico.
And that's it. The physicians who are employed by a hospital system, by the university, they are really insulated. But on the other hand, the flip side of that, if you are employed like that, you are much more mobile. Okay, if you're in private practice like I am, I've built up a practice over decades. To leave, I'm starting over unless I go into an employed position. Whereas employed physicians, they are very mobile. They can move and just pick up right where they are at another hospital in another state. So that's where physician-led hospitals that will try to recruit and keep the physicians.
In the community.
It's
about the community. Yeah.
It is about the community. It's about access. Whenever we go to the legislature, it is always about access to care. That's why we have those stats of how underserved the entire state is. And we have systems that are owned that have hospitals throughout the state. And so if they don't manage to keep their physicians because they are mobile, because they're not happy where they are, because it's a poor state, then that community loses their health care. And the hospitals are not very good at keeping their physicians. The turnover at a hospital-employed medical group is much higher than in private practice.
Dr. Bill Ritchie, thank you for being with us
Thank you very
this
much.
week, and thank you for everything that you do for physician-led care.
Appreciate it. Thank you.